Bismillahirrahmanirrahim. My name is Dr. Ambarachad and today my topic of presentation is health policy with introduction micro policy, health policy triangle and network analysis under supervision of Professor Dr. Saira Afzal. In this presentation, I shall be explaining what is health policy, policy process, policy triangle frameworks and policy and network analysis with recent updates and an MCQ session in the end. At the end of the presentation, the participants will be able to describe the basics of health policy, how policy frameworks and analysis helps in determining the accomplishment of a specific health policy. So coming up to the policies, policies are general statements that are based on human aspirations and sets of values and commitments and assessments of current situations and images of the desired future situations. First of all, it started in 1996 with an Ottawa Declaration. That was the Carter is for the global health as was achieved as a milestone and remains as a vital reference for health promotion. And it incorporates the 5 key action areas in health promotion that are the build health policy, create supportive environment for health, strengthen community, develop personal skills, reorientate health service, and the 3 basic health policy strategies to enable, to mediate, and to advocate, and makes the basis of this overall health policy and promotion of health for all population of the world. So, according to WHO, health policy is defined as the decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. And health policy, under health policy, we can achieve several things like it defines a vision for the future, it outlines priorities and the expected role of different groups, and it builds consensus and informs people. So, the spectrums that are covered under the health policy are financing and delivery of healthcare, quality of healthcare, making healthcare accessible to the all population, and promoting health equity among the populations. So there are several attributes that are makes the policy. For example, belongingness. Yeah, it means that it belongs to someone or somebody like a government body, a sole department, or a party, or at at a national level. Policy also has another attribute that it denotes a commitment. It has a stated intention and it also has desire to make things happen under one approved policy document. Policy has also a status, that is, it has the backing of some influential entity that can be some government organization, some private firm, or some kind of an institution or a university. So policy all starts with this policy cycle that starts with first the agenda setting, that is foresighting and identifying the emerging issues. Then it comes to the formulation with impact assessment. Later on it goes to the adoption, that is support and advise the regulatory bodies. And later on the most important and the most difficult part, the implementation. How the implemented, there is an independent verification, the methodological guidances, and how it will be implemented, all very important in this policy cycle. Later on the evaluation, that is at the evaluation for the effectiveness and the efficiency of this whole policy that has been implemented. And later on the support and maintenance with feedback and updates so that the deficiencies or the improvements can be made. So there is a potential role of government in the healthcare regarding this healthcare policies. As the government is the regulator of the healthcare policy, is the stimulator of the research, a protector of the deprived group, a financer of the health and the healthcare programs. It also acts as a purchaser for the healthcare services and is the direct provider of the services. So it has a potential role in healthcare and health policy development. Whenever the decision making comes, then the decision is made under several ways, like there are rational models for decision making, but these are too idealistics and difficult to implement as such. There is an incrementalism, that is more realistic but is too conservative. And the most appropriate and the midway approach is the mixed scanning approach. So whenever we come to the policy application and the levels at which the policy acts, is it acts usually in the health system, health management system, at three levels. One is the macro level, that includes the international organizations like European unions, nations, cities, and regions at government levels. The meso level is the local ecosystem and the industrial networks that are working interrelated in the whole country. And at micro level is at the individual level with the companies and the consumers, that makes this micro level. So at the micro level, we focus is on the accessibility, the effectiveness and appropriateness of the policy, the responsiveness, the safety, and the equity. At meso level, the effectiveness of the care. For example, if we are focusing on some kind of a healthcare policy, then these attributes related to the health policy are managed at the macro level, like what is the effectiveness of the care, what is the compliance with the clinical guidelines, patient related quality, organizational quality, safety, uh, etc., are dealt at the meso level. Whereas at the micro level, the measures related to the patient, that is quality of life, patient satisfactions, and measures related to the healthcare providers, yeah, all working at the individual level, is dealt at the micro level. And all these levels works in relation to the health policy. So, as a part of macroeconomics, there is a macro policy. So, in macroeconomics, policy is mainly concerned with the economic growth. That is concerned with increasing level of GDP. As higher GDP leads to greater opportunities to consume, which will improve the overall health. And the relevant factors in this relationship are improved nutrition, sanitation, water, and education, all comes under macroeconomic policy. So the three types of macroeconomic policies are the fiscal policy, the monetary policy, and the supply side policy. So at the micro level, the microeconomic policies improves the efficiency of the product markets, factor markets, and the industries. So these microeconomic firms are primarily directed towards improving the living standards through increasing productivity, allocative efficiencies, as compared to the macroeconomic impacts. And these includes the subsidies, the indirect taxes, the competition policies, the price controls, environmental policies, and regulations. So there are tariff reforms, industrial reforms, and deregulations that comes under all microeconomic policies. Coming up to the health policy analysis, it is a multidisciplinary approach to the public policy that aims to explain the interactions between the different actors and the contents and the contexts of the policy as given by Gilson. By another definition, analysis means separating a problem into its constituent parts so that to better understand it as a whole. So there is a 5E approach to a policy analysis, that is first to engage, then to explore, then to explain the problem, elaborate it, and then finally to evaluate it to find the outcomes. So why policy analysis is important in healthcare? Health policy analysis is important as it helps explains why certain health issues receive political attentions and others do not, such as by enabling identification of which stakeholders may support or resist policy reforms and why. So there was a Walt and Gelson policy triangle that was developed in 1994, and it based on the four basic elements that constitutes the whole policy triangle. That includes the context, that why need this policy, what is the need of this policy, what is the purpose of this policy, the content, what is the policy mainly about, That is the main subject. The process, how was the policy brought forward and implemented, and actors who participate in and influence the formulation and implementation. And graphically, the whole triangle acts looks like this, like actors in the middle with content, that is aims and objectives, and the implementation plan of the policy, the process of policy formulation and implementation, and the context, that is the situational factors, the political conditions, and the cultural factors that are affecting the whole policy process and analysis from outside. So, elaborating it further, the actors, these are the range and the characteristics of participants in the policy, as I've already told. For example, the role of relationship, interest, agendas, expertise in child, adolescent mental health. In coming to the content, the objective, values, and visions of service models and guidelines implemented for child, adolescents, mental health services are outlined in this part. For context, the socio-political, cultural, and health system context within which the child adolescent mental health policy was developed is the at the top of this whole triangle. And later on, the process followed to consult with key stakeholders across government sectors and non-government sectors constitutes the process. So, coming up to the policy analysis, there are two types of analysis. One is a prospective, and second is the retrospective analysis. So, coming to the prospective policy analysis, the analysis of the existing policies that have already been developed and implemented, and with some kind of analytic, which is analytical and descriptive, and it attempts to explain the policies and their developments. And analysis for a new policy, which is prospective, it is involved with formulating policies and proposals. For example, action-oriented prospective policy analysis to inform the adoption of a fiscal policy to reduce the diet-related disease in the Solomon Islands. This was the paper recently published, and the findings of this prospective policy analysis demonstrated that soft soda-based drinks were being consumed in relatively large amounts, especially by children, and they were likely to be substantial health, economic benefits associated with these soft soda-based drinks taxes. So there were document analysis and qualitative interviews were held, and the whole article suggests that there is a substantial scope for researchers to do more effectively engage with policy advocates to inform and shape real world health policy improvements. And increasing the taxes might decrease the consumption of these soft soda based drinks among the children. So it is an important part, and it might be a part of this prospective policy analysis. Now, in terms of retrospective analysis, is refers to the historical analysis and interpretation of past policies. This type of policy analysis is done to confirm the major aspects of historical policy research available on the problem under consideration. Like, this was a paper recently published, like Agenda Setting for Tobacco Control Policy in Iran, a retrospective policy analysis study. So it was, since it was a historical and a retrospective policy analysis, so it was seen that tobacco use was the fourth leading risk factor of non-communicable disease in Iran. So the adoption of this comprehensive law or national control and campaigns against tobacco in the Islamic Assembly in 2006 is the turning point. And this whole paper focused on the that there are on the need for this tobacco convention control that strengthens the comprehensive plan of national control tobacco as a policy stream. But still, there are challenges in developing effective policies for tobacco control in Iranian settings that was seen in this retrospective policy analysis study. Now coming to the frameworks. A policy framework is actually a document that sets out a set of procedures and goals which might be used in negotiation or decision making to guide a more detailed set of policies or to guide ongoing maintenance of an organizational policies. What is a health policy framework? Like in many countries, health sector is the major part of the economy. So the health policy guides choices about which health technology to develop and use, and how to organize and finance the health services, or which drugs will be freely available. For these, we need some frameworks. So this policy frameworks actually aims to provide guidance for all the staffs involved in policy development, including approval, publication, and review. The whole framework concept works with these three frameworks, that is the conceptual framework, the evidence based frameworks, and the integrated frameworks. The conceptual framework is the concepted framework and is an analytical tool that is mostly used in research to see how this policy or the whole document with the policy objectives and goals and the basic principles, and whenever it is provided hypothetically in a research, it will be done to see how it will work, and then later on it will be implemented in the form of an actual policy. So it includes the policy guiding principles, as this was a conceptual framework of Sudan National Health Policy 2017-2030, used as an analytical, firstly used as an analytical tool with the primary objectives underlying these headings, and the primary goal to attain the highest possible standards of health and well-being for all the Sudanese in the flexible manner, and ensure a healthy life and well-being. And the second example is for the evidence-based public health framework. This evidence-based public health framework actually works in a way that is based on the already previously applied policies and the researches that have been done, and based on those factors, with focusing on the issues like accessibility in the community, the what is the issue, and for which we summarize the scientific literature, and later on it develops a prioritized program and policy options, and conducts action and planning, implementation program and policy, and then evaluation, which includes disseminate, retool, or discontinue. That would be depending on the evaluation of this policy program. That would all be evidence based. And later on there is an integrated framework of policies that integrates several organizations at different levels that are involved in this whole policy making process for solving the problem that makes the core of this whole framework, and surrounded by the uh, recommendations, the policy actions, the outcomes, and the evaluations. And it involves several organizations and at international or national levels that focuses on single policy problem. These the outcomes of these frameworks provides assurance and the accountability, and provide a focus for the quality improvement. That is why these framework are important in health. So a slight difference between a policy and a framework. Actually, a policy there is only a difference of noun between them. So the policy is the art of governance. The political science or the policy can be contract of insurance, while a framework is literally the agreement of support beams that represents a building general shapes and sizes. So one of the forms is the network analysis. It based on these frameworks is a policy network analysis, and mainly in the field of research in political science, focusing on the links and interdependence between government sections and other societal actors, aiming to understand the policy making process and the public policy outcomes uh, um, diagrammatically or graphically. So there are iron triangles and issue networks that affect these policymakers in these frameworks and these networks analysis. There are interest groups that use iron triangles to provide the government with the policy knowledge, the lobby government, and provide government officials with campaign donations. And all these activities are intended to influence the government policies. And in mostly in developed countries, there are issue networks that often push for change in the policy within the government bureaucracy. Now, these are some types of these shapes that are formed after network analysis, like that can be centralized, dense and non-centralized, it can be fragmented, closure, or two types of ties or ties between actors within attributes. This is an example of this dense non-centralized type of network analysis, showing the involvement of d- different organizations and different guides, interlinking all these uh, uh, organizations like ministries and state councils and central committees working on the single policy shown by the different sizes of circles, showing the different rules of participation and the key role of the central committee, that is shown by this star. So all the symbols and networks are meaningful. So here is one of the examples of a policy network as a unit of analysis of public policies. It was a case study of social and health insurance policy network in Egypt from 2015 to 2019, showing different types of networks and are interlinked for a policy network, like private sector, states, civil societies, international organizations, and policy networks. It's a simpler form of network analysis and showing the how these policy is working with a contribution from all these states. This is rather a complex form of policy network of aid policy network in Pakistan for the actors in the network analysis. These are the symbols that are denoting the different donors for the aid that comes to Pakistan. Like in the center, this is for the World Bank and the mini finances. Later on, the outer circle shows this is like a scattered network analysis with countries that are involved, and later on the bilateral donors and NGOs and networks comes out, and the provincial departments comes at the outer circles. So it's form of a complex network analysis. Now coming to the recent updates. Recently, a paper was published that does an improvement in rural infrastructure contribute to alleviate poverty in Pakistan, a spatial economic analysis. Actually, this study was aimed to analyze the impact of rural infrastructures, and the analysis was done. And from a policy perspective, the findings suggested that the government should take appropriate measures to overcome the energy poverty in rural areas, that is up to 35%. It also gave the previous background and what to achieve and targets by the national policy, water policy, and hence the study may provide evidence informing a debate on the role of public infrastructure investments in the developing countries. Hence, it was the complete picture starting from the problem and going to the solution. And the second paper was a policymaker perspectives about e-government success using a health policy approach, policy implications towards entering a good governance in Pakistan. So this was also an important paper showing the gap that is caused by the paucity of the literature in terms of empirical based techno policy research in the e-government domains. And this study contributed in several ways that it highlighted the significance of e-government as a technology for attaining good governance, and finally provide guidelines for the government to formulate e-government policies and strategies as per needs of stakeholders in Pakistan. So now it's time for the MCQs. The health minister XYZ wants to analyze the current challenges present in the National AIDS Control Program and revise the overall policy. Which of the following option is correct step by step pathway used for such policy analysis? Either it starts from the data collection, going to implementation, and approaching to problem solving, starts from analysis and policy to determine assessment, planning, intervention, or first identifying, analyzing, problem development, implementation, and evaluation.
D.
Yes, D is the right answer because it starts with identification problem, ending at evaluating the policy as shown in the analyzing cycle. A team of analysts XYZ decides to make a new hospital policy to combat rapid rising cases of non-communicable diseases. For such process, which of the following is not a part of the analysis of the policy being developed for health issues? Implementation of policy needed, evaluation of the overall impact, collection of the data and research or current and past, and determining the ownership of the health policy and the audience is not the part of this analysis policy being developed for health issue. All the three options, first options are the part. The third part of ownership of the health policy and audience is later on decided and not at the part of this whole analysis process. So it is D. The fourth national immunization campaigns of year 2021 reached across the nation in December to vaccinate more than 40 million children under 5 in 156. During this campaign, several social and cultural problems were reported. According to this health policy triangle, these problems lies in which section? The content, the context, the actors, and the process.
Context.
Yes, B is the right answer, the context. The Global Polio Eradication Initiative will launch a Polio End Strategy 2022-2026, delivering on a promise at a virtual event to overcome the remaining challenges. That includes the setbacks by COVID-19. Final analysis done to estimate high immunization coverage of children in first year of life at the end of the program. Which type of analysis? Prospective analysis, retrospective analysis, interactive analysis, health policy analysis.
A.
Yes, A is the right answer. That is the prospective analysis. A teacher XYZ addressing to the group of students had an interactive session on the topic of health policy analysis. He asked the students to choose one of the best statements that describes the questions one might ask in analyzing health policy. The best statement. Uh, Either they will ask who will benefit from this health policy, or either they will inquire how can we implement this health policy, or how has this health policy been utilized, or are these any changes that needs to be made in this health policy? The most and the one best statement that might address regarding health policy analysis.
D.
B is the right answer. How can we implement this health policy? Because implementation is one of the most important, it is very difficult and tedious part of this health policy. So the it might be all other options can be the answer, but choosing one of the best, then B is the right answer. Most research conducted recently found that raising cigarette prices through increasing in tax is highly effective measure for reducing smoking among young adults and persons of low economic status at government level. At which level this policy works? Meso level, macro level, micro level, or primary level?
Macro level.
Macro
B.
level. Yes, B is the right answer because at government level it's always macro level. In a study titled Characteristic of Deliveries at a Tertiary Care Hospital in Turkey, results from a retrospective analysis, and most deliveries conducted in tertiary care hospitals are due to fetal distress. According to this health policy triangle, this tertiary care hospital setting is placed at which segment of the triangle? The content, the context, the process, the actors.
Context.
Actually, this would be the organization, so it would come to the actors. A very key point in the process of COVID-19 control is the introduction of effective policy measures, whose results must be needed continuously noted continuously through an accurate statistical analysis. When a dedicated group keeps continuous oversight of activities to ensure that they are proceeding according to plan, so they are doing either monitoring, recording, planning, or evaluation.
Monitoring.
Yes, they are doing monitoring because continuing oversighting of activities is monitoring. Evaluation is mostly done at the end of the project. National Health Vision is a significant achievement of the current government. This vision will serve as an inspiration and guiding roadmap for all those implementing reforms of strengthening health systems. One of the strengths of this national health policy is implementation of healthcare delivery at which level? At provincial level, at union level, at district level, or tehsil level?
District level.
Yes, it's at district level. C is the right option, district level. Public mental health policy aims to improve population mental health and well-being, prevents the onset of mental and emotional distress and resilience. For such policy analysis, we refer to the systematic evaluation of dash and dash implications of public policy. Technical and political, concrete, plastic, judicial and social, legislative, and executive. It's A, that political and technical both are the implications of public policies under this policy analysis. So A is the right answer. This is the key and the reference for my presentation. And thank you.
Thank you very much, Dr. Amber. It is an excellent presentation. And as I have said yesterday, that references should be in the footnotes. It should not be at the end of the presentation because it is very difficult to relate what points are present in this reference that has been shown in the end. However, it is a very good presentation, especially about the micro and macro level policies, how the systems they are going to implement and disseminate all the rules and regulations, and that is the importance of all this. There are many important points that are still to be elaborated in coming days, and in the end of this session, we would revisit many of the policies that are in place and how we can improve them further. Just like yesterday when I was talking about the screening programs and how the different screening programs for provincial and national governments, they are having a big role in preventive medicine and how this policy is going to affect the public at large. Similarly, we have seen the Sehat card and the health insurance systems that are in place. So we would talk more about all these things in our further sessions. Thank you very much. If anybody has any question, please do let me know. Okay, excellent presentation, Dr. Amber, like always, and you are very responsible and a very senior, Alhamdulillah, postgraduate student of mine, and I feel always very proud of you, and this again has been proved today. Thank you very much, and Allah Hafiz.
Thank you, Ma'am. Allah Hafiz.